his first work on getting accurate medicine, so, so on behalf of Tulsi Trust, I would like to welcome Dr. Shah and ask him to start with the presentation. Just 2 minutes, whilst I give a small introduction on Tulsi Trust, which is an NGO which has been in existence since 1975. It has been set up by the Chanrai family, who's also responsible for Jasrok Hospital. Tulsi Trust deals with education, with medical support, with skills training, and especially now with the geriatric care, which is being introduced under the name of graceful living. So Dr. Shah's presence here today is through graceful living, and he is going to speak mostly about the use of homeopathy for senior adults in as an alternative to allopathic medicine, which sometimes are very strong. So I hope this is clear, and I wish all of you a very happy and informative presentation. Over
Thank
to
you
you,
so
Dr.
much,
Shah.
sir, for the lovely introduction, and good evening to all of you. So let me begin my talk with some of the cases where homeopathy is of real help. If you see this patient I saw, it is a case of a burn, simple burns where some, I think, water or something fell on her leg. And because she is a faithful patient of homeopathy, instead of going to the allopathic doctor, she contacted me around this date. We took her symptoms and prescribed some effective homeopathic remedies. And over a period of 10 days, everything resolved without any help of any modern medicine. Similarly, this is another case of psoriasis, which is one of the very difficult diseases to treat. In fact, modern medicine has very limited, what do you say, solutions to treat this particular problem. And this patient had come to me long back. She took medicines for 1 year, and after 1 year, if you see that all the rashes or the roughness of the palms with itching and all that completely disappeared. She is free of any medicine as of now, and she is going to become a mother again. Similarly, this was a very strange case that I saw. It is a case of a child, 3-year-old child came to me for complaints of stomach pain and vomitings. And based on the symptoms of her stomach pain and when she used to vomit and all that, I prescribed her a remedy and followed up for 6 to 9 months. And then her problem disappeared. And then then COVID came up for 2 years. There was no follow-up, and she was absolutely fine. Post-COVID, she again developed this stomach pain, and pediatrician advised her to get a sonography. And it was interesting for us to see that when she came to me, there was a little stone, 4.9 mm, which was there, which was causing this pain. And it is very strange because these gallstones are not present in a child of 3 years of age. Normally, the presence happens after the age of 40, and especially in females. So we don't know how come she landed up with this problem. And to my surprise and to the pediatrician's surprise, without any operation, when they went for a sonography again, we see that there is no evidence of any gallstone. So it was a very satisfying case. Similarly, there was one patient who was diagnosed with autoimmune thyroiditis, whereby your TSH levels are very high, and based on that, the doctors ask us to take thyroid medicine for lifetime. And this patient was very young when she came to me. She was around in her 20s or early 20s. And the mother said that we don't want her to be on any medicine for lifetime purpose. So they started treatment with me, and after 1.5 year, 2 years, we periodically we kept on doing her thyroid report, And as the TSH started coming down, we reduced her thyroid medicine gradually. And it has been more than 7-8 years now. She is off her thyroid medicine and she has no evidence of this Hashimoto's thyroiditis. Similarly, this is a serious case of psoriasis treated by my colleague, Dr. Pratik Desai. You see, this is a severe psoriasis, and he took treatment, and it is surprising that in 2 months he showed such a dramatic improvement, and he continues to do well. Then this is one of the case of my very well respected teachers in Kolkata. He is a master to treat cancers. His name is Dr. Sunirmal Sarkar sir. And we see that this patient had a liver cancer. And after a suitable homeopathic treatment, there is no metastasis and there is no cancer, evidence of cancer. So these are small glimpses of what homeopathy can do. I would like to address something which one of very senior pediatrician, Dr. R.K. Anand, has to say about homeopathy. So let us have a look. Wait a minute.
The funny thing is that
Let me share the screen again. Dr. R.K. Anand sir is a very well-known senior pediatrician. He was the head of pediatrics, I think in Jaslok Hospital only, I'm not sure.
is there in person to talk to us?
Sorry?
Is he there in person to talk to us just now?
Now now he is not there.
Yes. Okay. All right.
That in US, the statistic has shown that 750,000 of people visit an emergency every year because of the side effects of drugs. And one out of these 3 people die because of the side effects of drugs. So this is another reason why you have to be careful, and as well as possible, safer avenues like homeopathy may be preferable. I must say to this audience, you are lucky if you are in touch with the homeopath. Homeopathy works, it is safe, it is gentle, especially for children.
This is what he says. Wait a minute. Just see if you can see my screen again. So what I want to share with you all is what are the basic principles of homeopathy and how it was discovered. So in the year 1790, a German physician, Dr. Samuel Hahnemann, he was an MBBS by profession, but the treatment given during that time, he was not happy with it. And that unhappiness led him to stop his medical practice, and he started working with translating books. And while translating books, he came across this chapter where it meant that there is a particular bark of a plant named as cinchona, or it is also called as China. So what was written in that particular book while he was translating is that if you have something, some part of this cinchona bark leaves or the bark of it, which is from which the quinine, that means the medicine for malaria, is made. If you take that, you develop symptoms which resemble malaria. So if you take a particular part of this particular plant and if you start having it, you will develop fever with chills, which is exactly what malaria has. And he was quite surprised that how is it possible that if you take something and you are getting a manifestation of symptoms which resembles a particular disease. And that drove him further to examine what exactly it is. So what he started doing is, along with this particular substance, he used many other substances and he started giving those substances to healthy human beings. And to his surprise, what he found is that people started producing certain signs and symptoms. And this gave him an idea that if a substance has an ability to produce something, then the same substance has the potential to cure that. You follow this principle? For example, I will tell you, if you cut onion, what happens when you cut onion? There is watering of the eyes, burning in the eyes, watering from the nose, and you want to go out in the open air, correct? Now in homeopathy, we have a medicine which is prepared from onion. So when a patient comes to us and he says that he has burning in the eyes with desire to rub the eyes, there is burning discharge from the eyes along with bland or watery discharge from the nose, then these symptoms resemble the symptoms of the onion, which is also called as Allium cepa, and that is the medicine that he receives. And if he receives exactly similar medicine, then it has a potential to cure. This is the fundamental principle on which homeopathy is based, and this is called as law of similars. The evidence of this law is also seen in our Sanskrit literature, where they say Vishasya Visham Aushadam. It means that it has been said of the old time in the world that poison is the remedy for poison. Later on, Hippocrates, who is also called as the father of medicine, postulated this principle in the word similia similibus curantur. This is what our principle is. This is the first principle of homeopathy. That means likes are cured by likes. In Marathi, they say katyane kata kadne. So there are evidences of this principle in ancient literatures on which the science is based. Now there are fundamental laws on which the science is practiced. First law is the law of similars, which I already explained you. Second is the law of holism. That means homeopathy is a holistic medicine. I will explain you what is holism, and also the third law is the law of individualization. And this is the second aspect that I would like to stress upon. So as far as the law of similars is concerned, I have already explained you that when we cut the onions, what happens is watering of eyes, burning and running of nose. This discharge burns and irritates our mucous membranes. So suppose a patient complains of runny nose, which is burning, along with watering of the eyes and irritation of the eyes, then in homeopathy, there is a solution, which is the name of the medicine is Allium cepa. Allium cepa is nothing but the onion from which this medicine is prepared. Let us take another example. What happens when we drink coffee? We become sleepless, our mind becomes more alert, and you are more into studies and creative ideas and all that. Now in homeopathy, the remedy is called as coffea. So whom do we give coffea? Patient who comes, who complains of sleeplessness, who says that my mind is full of ideas, especially in the evening. My mind becomes more active and I have a lot of creative thoughts in my mind at night when I go to sleep, and these thoughts don't let me sleep. Now, these symptoms are exactly resembling the symptoms of the coffee, which is what is proved on healthy human beings. And we give him a remedy prepared from coffee, and then the sleeplessness starts to get better. This is the fundamental idea, or this is the principle of holism. Sorry, the law of similars. Next, we come to the idea of holism. What is whole? Whole means where you consider the mind, the body, and the spirit, you can say, or the soul, or the Atma, or whatever name you want to give. Homeopathy considers all these three aspects together when we are going to make a homeopathic prescription. So that is why when you go to a homeopath, you see that the history taking is very long. And what happens in the history taking? We are not only asking about the physical symptoms, but we also ask what you like to eat, what position you sleep in, how is your thirst for water, what is the thing that you don't like to eat, whether you can tolerate cold or whether you can tolerate heat, how is your nature, what are your fears, what are the dreams that you have, what are the stressful situations that you have experienced. And then we take all these symptoms into consideration and then prescribe a remedy. It is not just prescribing on the body, but it is prescribing on all the three things that makes us as whole, makes us as one as individual. Unfortunately, what has happened nowadays is that if you have a toothache, you go to a dentist. If you have a stomach ache, you go to a gastro. If you have a headache, you go to a neuro. If you have a joint pains, you go to an orthopedic. This is the concept which has been kind of, in the medical profession. In a way, it is good, but it also loses out on treating the patient as a whole. That idea of family doctor, where you had a toothache, you went to a general practitioner, a family doctor, he only used to prescribe something. When you had a stomach ache or headache or whatever, the same doctor understood the dynamics in the family, the same doctor knew the nature of the person, the same doctor understood the body, is kind of missing. And that is a sad story. However, that culture can be kept alive with alternative medicines like homeopathy and maybe Ayurveda. I don't know much about Ayurveda, but any system which deals in holistic approach has a potential to treat the patient as a whole. And that is anytime has much more, what do you say, long-term healing effects than what we have right now, that we are treating only the parts. You see, there was one person called Plato. He says, as you ought not to attempt to cure the eyes without the head or the head without the body, so neither ought you to attempt to cure the body without the soul. And this is the reason why cure of many diseases is unknown to the physicians of Greece, because part can never be well unless the whole is well. So many times you see there are people who come to us, or you all also might be experiencing that even if you go to a doctor, you have a headache, you take the medicine for the headache may disappear, but internally your energy wise you say that I have no complaints, but I don't feel well. What is that I don't feel well? That is where holistic aspects come into picture. That means there is something within which is also giving us some problem which is not either understood by the doctor or by our own selves, whereby we can communicate. This phenomena is very well addressed with homeopathy. I'll give you one example. Many times patient come to us, they are not known to these concepts of holism and all that. They come and they say, okay, I have headaches, and they give the symptoms, whatever, and we try to investigate all possible aspects about their complaints, and we give a medicine. Then after 1 month, 2 months, or 3 months, the patient says, doctor, have you given me medicine for my allergic cold? Because this time when the season changed, I did not get a cold. Now, how did this happen? He only came for a headache. He did not describe his allergic problems. However, the medicine which was selected for the headache and for the individual as a whole also helped the other problems which the patient might feel that he does not need to tell the information to the doctor. But that also starts getting well. Or for example, patient has some complaint which he is used to, let's say for example, sleeplessness, and he comes to you for say stomach pain or constipation, and you take the symptoms of the constipation, you understand his nature, you understand his other aspects, his routine, and you prescribe a remedy. And after 2 months or 3 months or 4 months, the patient starts to experience that his sleep has improved. Now the quantity and the quality of the sleep is getting better. He has not asked the medicine for sleeplessness, but after starting this holistic treatment, they start to feel the change on a whole. This is the principle on which homeopathy works. For example, you see, you go to a modern medicine. What does the modern medicine look at? Emphasizing what is the diagnosis? What is the problem that you are suffering from? What is the nature of the headache? Is it a migraine? Is it a tumor? Is it a sinus headache? Is it a stress headache? Is it a cluster headache? Or whatever may be the hypertensive headache. So the modern medicine focuses on the diagnosis, and which is true as well, because the medicine for them is based on the diagnosis. If they don't come to a diagnosis, then they cannot prescribe. That is why they prescribe the disease in man, disease or the parts of the body. Whereas a homeopath prescribes for the man in disease. There is a difference. Disease in man is different and man in disease. That means what kind of a person is having the headache. A, a headache is happening in a person who is very impatient, who is very ambitious, who is very workaholic, who remains awake at night, who has multiple tasks to do. For that, he starts having coffee or tea and finishes lot of assignments, lot of projects. Why? Because he wants to reach to the highest goal. He want to achieve the promotions. He want to work hard. He feels that he wants to be the best in the office. Now, this is the nature of a person. Now, this kind of a person is suffering from a headache, which is happening in the forehead. It is better by pressure. It is worse when he wakes up. It is worse with work pressure. It is better after he passes motions. Now, when we have the symptoms of the headache and we understand the personality of that person, then we prescribe a medicine. This is the idea of holism. Then the next law that comes is individualization. This is also very interesting. You see, when you go to a modern medicine doctor, it is like going to a ready-made shop to buy clothes. So, you go to a shop where ready-made clothes are available. You go, you try some clothes and they fit you and then you buy it. Whereas going to a homeopath is like going to a tailor. So what does the tailor do? The tailor will take all the measurements, then he will note down the measurements, then he will start stitching your clothes. Then you go, when the clothes are ready, you will try that. Then you will, after wearing it, you will say, this one is a little loose, this is little tight, this is coming a little down, or whatever may be. So the tailor will again modify little changes which have happened after stitching. And then again you go and you wear, and then you say, now this looks absolutely perfect for me. This is the kind of material that I'm looking at. This is the idea of going to a homeopath. So the homeopath will take all your symptoms, study them properly. He will try to differentiate how 10 people having the same problem. For example, 10 people have migraines, but every migraine is going to be different from each of those 10 people. One will say, my headache starts from the forehead and it goes behind. The other will say, I have headache which is located only around the eyebrow. The third will say, the headache starts from the back of the neck, it travels here and then it settles there. Fourth will say, whenever I have a migraine, I don't want anyone to come near me. I just want to lie down, close the lights, switch off the lights, close the curtains. There should not be any disturbance, and maximum someone can just keep pressing my head. Now, what is happening? The problem is same. Everyone has got migraine. You go to a modern medicine doctor, he will give you Migranil or Naproxen or whatever, based on the intensity of the headache, once a day, twice a day, or thrice a day to the maximum. Whereas for homeopath, it is not only the type of the headache, where the headache is located, what is the type of the headache. Someone will say it is hammering, someone will say it is throbbing, third will say it is pulsating, fourth will say it's as if going to burst. So the nature of the pain will also, then you will also understand what is the type of personality that you are dealing. So the headache is happening in a person who is very sensitive, who is very mild, who can cry at the drop of the hat. You scold him or raise the voice, and then he or she will start crying. And then you pamper or you hug or console, then that person feels better. The other person will say that the headache has started after the loss of my loved ones. Then he will say that my headache is mainly located on the left side. It starts as soon as the sun, from 10 o'clock in the morning until the sun sets. Then he says, whenever I have a headache, I don't want anyone to come near me. I just want to be left by my own self. No one should come, no one should console me. Third person I told you, that who's very ambitious, impatient, workaholic, industrious, wants to do things. So what we are doing, we are not only considering the physical symptoms, but we are also considering the nature, the personality, based on which the headache will be, the medicine for the headache will be selected. I will show you one clip which will help you to understand how people are different. Let us try to see this clip.
So what happened?
I'm just sharing the screen, just a second, to show that clip.
हेलो मासी जी हॉल्टर कुर्ती बनवानी है मासी जी मुझे ना एक अनारकली कमीज सिलवानी है तो 32 कली दीजिएगा मुझे एक चाइनीज कॉलर चाहिए नेक मेरे को चाहिए स्वीट हार्ट शेप का और मुझे स्लिम दिखना है बिल्कुल स्लिम तो याद है रानी ने एक मूवी में पहना था थोड़ा नेट फिर थोड़ा चिकन फिर थोड़ा नेट फिर थोड़ा सा घुंघरू चाहिए मुझे थोड़ा सा छन छन आप मुझे बैक पे एक ऐसे क्रिस क्रॉस करके एक डोरी दे दीजिए एक काम करना 3 इंच रखना मेरे को टैटू शो करना है पॉसिबल
So you see, people, they want to stitch a particular clothes, but everyone has a different requirement. This is what is the principle of individualization, is what I'm trying to explain. सिलाना ड्रेस ही है, पर हर एक को इस हिसाब से सिलाना है कि उनको उनके पसंद का चाहिए. सिमिलरली बीमारी शायद एक ही हो सकती है, बट वो बीमारी के जो सिम्टम्स है, वो बीमारी के जो जो लक्षण है, हर एक में अलग अलग हो सकते हैं. फॉर एग्जाम्पल सर्दी हो गया, एक को एसी में रहेंगे तो सर्दी ज्यादा होगी, पर एक बोलेगा कि जब मैं रूम में आता हूँ, जब वो रूम गर्म होती है, तब सर्दी ज्यादा बढ़ती है. ये जो डिफरेंसेस है बीमारी में, ये डिफरेंस को हम आइडेंटिफाई करके मेडिसिन सिलेक्ट करते हैं. दिस इज द आइडिया. लेट मी गो बैक. और प्रॉब्लम होम्योपैथी का ये सबसे एडवांटेज भी है और यही प्रॉब्लम भी है, क्योंकि पेशेंट्स जो है, दे आर नॉट वेरी वेल अवेयर कि हमको ये सब इंफॉर्मेशन बतानी है, और उसके कारण हमको होम्योपैथिक मेडिसिन फर्स्ट अटेम्प्ट में नहीं मिलती है. दैट इज द चैलेंज. जो पेशेंट हमारे पास आएंगे और वो एकदम क्लियर सिम्टम्स अगर दे पाएंगे, जैसे फॉर एग्जांपल अभी जो कोविड हुआ लास्ट 2 इयर्स में, उसमें क्या हुआ, पेशेंट के सिम्टम्स इतने क्लियरली आ रहे थे कि पेशेंट को रिलीफ भी उतने जल्दी मिल रहा था. नहीं तो प्रॉब्लम क्या होता है कि हम पेशेंट को सवाल पूछते हैं, फिर पेशेंट बोलता है अरे डॉक्टर हमने तो ये ऑब्जर्व ही नहीं किया, हम नेक्स्ट टाइम आके आपको ऑब्जर्व करेंगे. हम पूछते हैं कि आपको डर क्या लगता है, अरे पता नहीं, सोचना पड़ेगा, सोचा नहीं है. फिर सपने क्या आते हैं, अरे वो तो आते ही नहीं है, या फिर आते हैं तो हम भूल जाते हैं. तो हम अगले टाइम क्या करेंगे, नोट करके रखेंगे और आपको बताएंगे। तो इसमें क्या होता है, अगर पेशेंट्स हमको एक्यूरेट सिम्टम्स नहीं दे पाए तो अ लॉट ऑफ टाइम इज वेस्टेड इन फाइंडिंग द राइट सिम्टम। उसके लिए मैंने देखा है कि दैट इज व्हाई आई हैव सीन कि जो पेशेंट्स मेरे साथ लॉन्ग टर्म रहते हैं, 6 महीना, 9 महीना, 1 साल, उन लोगों में द कंसिस्टेंसी ऑफ सक्सेस इज हायर कंपेयर टू दोज पेशेंट जो 2 महीना 3 महीने के लिए ही आते हैं। फिर वो क्या होता है कि एक ही अटेम्प्ट में सिम्टम्स मिलते नहीं है, और अगर एग्जैक्ट सिम्टम्स नहीं मिले तो हमें फिर प्रॉब्लम होता है दवाई ढूंढने में। फिर लोगों को लगता है कि यार होम्योपैथी स्लो है, पर एक्चुअली वो वैसा है नहीं, क्योंकि 3 महीने लग जाते हैं कभी कभी एक सिम्टम मिलने को, और चौथे महीने में वो पेशेंट ऐसा 1-2 सिम्टम बोल देता है जिससे दवाई इतनी क्लियर हो जाती है। तो आफ्टर 4th मंथ पेशेंट बोलता है कि ये 4 महीने के बाद हमको फर्क लगा, पर एक्चुअल में 4 महीने के बाद फर्क नहीं लगता है, फर्क लगा उसी महीने में, 4th मंथ में। क्यों? क्योंकि उन्होंने कुछ ऐसे अपने बारे में इंफॉर्मेशन बयान की जिसके कारण वो दवाई मिलना और आसान हो गया। दैट इज द डिफरेंस। ये मैंने आपको ऑलरेडी शेयर किया है कि एक पेशेंट बोलता है कि आई हैव द पेन इन द नेक एक्सटेंडिंग ऑन टू द राइट साइड ऑफ द फोरहेड, तो दवाई अलग है इधर। और दूसरा बोलता है कि मुझे लेफ्ट आई के यहाँ पे पेन है, और फिर वो यहाँ पे जाता है और फिर धीरे धीरे बढ़ता है और धीरे धीरे कम होता है, ये भी मायने रखता है, तो उसके लिए दवाई अलग है। तो ये सब चीजें बहुत ही you have to observe it microscopically, and if you are able to do that, then you have a better chance. So no two people are alike, and similarly no two people react alike in the same sickness. For example, अगर किसी की डेथ हो जाती है तो हर एक इंसान का रिएक्शन वो सिचुएशन के प्रति, सिचुएशन सेम ही है। एक का फादर गया, या समझो 2 ब्रदर्स हैं, इवन फॉर एग्जांपल टेक 2 ट्विन्स हु आर रेज्ड इन द सेम फैमिली, who are raised by same parents, same food, same surrounding, same school, same teacher, same tuitions, everything same, but what happens, both of them react differently. तो ये रिएक्शन डिफरेंट कहाँ से आता है? वो हमारे नेचर के कारण आता है, वो हमारे इंडिविजुअलिटी के कारण आता है, और यही हम आइडेंटिफाई करने की कोशिश करते हैं। और जब ये क्लियर होता है तो चांसेस ऑफ सक्सेस आर वेरी वेरी हाई, एंड नॉट ओनली हाई, जो चीजें जो मॉडर्न मेडिसिन बोलती है कि इसमें कुछ नहीं हो सकता, ऐसे केसेस में भी रिजल्ट्स मिलते हैं। जैसे मैंने आपको बोला, जो मेरे सर थे डॉक्टर सुनिर्मल सरकार, उनके पास इतने कैंसर के केसेस आते हैं, माय गॉड, एंड सो नाइसली द रिजल्ट्स आर सीन इवन विदाउट कीमोथेरेपी। एक मुझे पता है, जब मैं पढ़ाई के लिए गया था उधर, इतना बड़ा थ्रोट का कैंसर था, कोई भी एलोपैथिक डॉक्टर हमेशा बोलेगा कि इनको कीमोथेरेपी कराओ, रेडियोथेरेपी कराओ, बट द पेशेंट हैड ट्रिमेंडस फेथ इन दैट पर्टिकुलर माय टीचर। तो उन्होंने 2 साल तक दवाई लिया, और कैसे थोड़े थोड़े टाइम के बाद वो ट्यूमर श्रिंक हुआ। फिर एक पॉइंट ऐसे आया कि इधर गले में बॉडी ने ऑटोमेटिकली एक सर्जरी जैसा होल किया, फिर वो होल करने के बाद उसमें से काफी सारा पस ड्रेन हुआ, और फिर वो इंजरी हील होने लगी, फिर उनका आवाज वापस आने लगा, and then after the end of 2 years that patient is absolutely fine without any chemo or radiotherapy. But that can only happen with people like him who are very experienced. And of course कि जो पेशेंट ने जो सिम्टम दिया था, वो बोलता है मैं सब कुछ सॉल्व कर सकता हूँ पर मैं पानी सॉल्व नहीं कर सकता। नाउ आप इमेजिन कीजिए कि इतनी छोटी सी बात वो पेशेंट ने बोली, क्योंकि वो दवाई जो थी उसका चॉइस ये सिम्टम के आधार पर था कि मैं सब कुछ सॉल्व करूं पर पानी सॉल्व नहीं कर सकता, और ये सिम्टम के ऊपर उसको दवाई मिली थी। दैट इज द ब्यूटी ऑफ होम्योपैथी। देन दैट इज ऑल्सो द बेस्ट थिंग अबाउट यू इज यू ऑलवेज रिमेंबर कि यू आर यूनिक जस्ट लाइक एवरीवन एल्स, having your own unique potential of experience, something that has never been and never could have been experienced by anyone else, thus treating and recognizing you as a unique entity rather than simply admiring. क्योंकि हर एक इंसान एक यूनिक आइडेंटिटी, एक यूनिक नेचर लेके आता है. हमारा काम एज अ फिजिशियन इज ओनली टू आइडेंटिफाई कि ये पर्सन कैसे दूसरे से अलग है, इसमें क्या ऐसी क्वालिटीज है जो इसको उसकी पर्सनालिटी बनाता है, क्यों एक ऐसा रिजर्व्ड रहता है, क्यों एक ऐसा एकदम एक्सट्रोवर्ट रहता है, क्यों एक एकदम ऐसा सहमा हुआ सा रहता है, और क्यों ये एकदम ऐसे बोल्ड और करेजियस रहता है. ये सब चीजें आइडेंटिफाई करके दवाई सिलेक्ट की जाती है. फिर लेट अस अंडरस्टैंड, अभी ये रिपोर्ट बहुत ही पुरानी है, 2011 में स्विस गवर्नमेंट की रिपोर्ट है, where homeopathic medicine and treatment according to them is effective and cost effective. 85% of Swiss population want complementary alternative medicine which includes homeopathy, and more than 2/3 of voters supported the inclusion of homeopathic medicine. और recently मैं आपको बोलता हूँ कि ये स्विस गवर्नमेंट की ये इंश्योरेंस में भी होम्योपैथी इंक्लूड हुई है. फिर there is one research article which has been published जिसमें 24 studies out of 29 in upper respiratory tract or allergic reactions found positive result in favor of homeopathy. And this is absolutely true, I tell you, because my majority practice is children, and if I see 10 children cases, 8 of them have allergic problem. And the reaction or the problem of this allergy इतना बढ़ गया है हमारे कंट्री में, and especially in metros, that lot of children are suffering from recurrent cold and cough. फिर हर महीने antibiotic, हर महीने injections and what not they have to take. But if they come under an holistic practitioner who takes the case properly and prescribes a suitable remedy, तो ये antibiotics का need, frequency of infections gradually starts coming down, and after 1 year, 1.5 years, they are free from this problem. और उसका example मेरा my own child who used to suffer from recurrent cold and cough when he was 3 years and 4 years. I started giving him homeopathic medicine, and I'm proud to say that over a period of 7 years now, his need to take antibiotic was only twice. Once when he got typhoid and I couldn't prescribe a remedy, and one when we were traveling and I had no access to homeopathic medicine. तो ये मैंने काफी देखा है, और उसके लिए मुझे बहुत ही कॉन्फिडेंस भी है कि ये सच है, और मैं कन्विक्शन के साथ भी बोल सकता हूँ कि यस, दैट इज द ट्रूथ. 40% of French population also have used homeopathic medicine, and 42% of the British physicians, 62% US population uses complementary alternative medicine, which includes homeopathy. World Health Organization, you forget these reports also, just see कि अभी COVID में क्या हुआ था. There was no medicine available. There was no surety कि वो जो भी दवाई थी, I forgot even the name, Remdesivir, whether it is going to work or not. And now they are coming with the report that उसका कोई जरूरत ही नहीं था. Simple measures like improving the immunity with home medicines, turmeric हो गया, गर्म पानी हो गया, not eating outside हो गया, proper hygiene maintain करो, that itself was enough to help people. And mainly it was about the immunity, and this is exactly where होम्योपैथी addresses. तो जब पेशेंट्स हमारे पास आते हैं बैक्टीरियल इन्फेक्शन, वायरल इन्फेक्शन लेके, तो इट इज नॉट दैट होम्योपैथिक मेडिसिन्स अटैक अ बैक्टीरिया और अटैक अ वायरस. वी हैव टू फंडामेंटली अंडरस्टैंड कि हमारे अंदर एक प्रतिकार शक्ति होती है विच इज कॉल्ड एज इम्यून सिस्टम. तो सपोज हमको लग जाए तो क्या होता है, इवन विदाउट टेकिंग द मेडिसिन, वो इंजरी अपने आप, इट हैज अ पोटेंशियल टू गेट बेटर अनलेस यू आर अ डायबिटिक, और डायबिटीज पेशेंट्स में दैट इज अ डिलेड फेनोमेना. सो ये हीलिंग कैसे होता है, कुछ न करने से भी, बिकॉज अंदर ही हमारे अंदर वो शक्ति है. तो होम्योपैथिक मेडिसिन targets that inner immune mechanism of the body, and it tries to improve that immune system. and not targeting the bacteria and the virus. This is very important. नहीं तो एलोपैथी में क्या होता है कि हमको स्पेसिफिक एंटीबायोटिक विच इज एंटीबैक्टीरियल और स्पेसिफिक एंटीवायरल मेडिसिन देना पड़ता है। स्पेशली एंटीवायरल मेडिसिन उनके पास है भी नहीं एक्सेप्ट मे बी फॉर हर्पीज, बट वो लोग एंटीबायोटिक्स ही देते हैं क्योंकि जब हमको वायरल इन्फेक्शन होता है तो हमारी इम्यूनिटी कम होती है। तो हमारी इम्यूनिटी कम होती है तो सेकेंडरी बैक्टीरियल इन्फेक्शन होने के चांसेस होते हैं। डॉक्टर क्या करते हैं कि 5 दिन की एंटीबायोटिक्स देते हैं। हम 5 दिन तक एंटीबायोटिक्स लेते हैं और हमको लगता है कि एंटीबायोटिक से ठीक हो गया। वो एंटीबायोटिक से तभी ठीक होगा कि अगर बैक्टीरियल इन्फेक्शन है, पर अगर वायरल इन्फेक्शन है तो एनी वायरल इन्फेक्शन कैन गेट बेटर इन 7 to 14 days। तो हमको लगता है कि अरे एंटीबायोटिक दिया तो हम ठीक हो गए, पर एक्चुअली तुम्हारी बॉडी अंदर से ही काम कर रही होती है वो वायरस को नष्ट करने में, वो वायरस को डिस्ट्रॉय करने में। So what does the World Health Organization say? That it is the second largest system of medicine. It adds that it's practiced in 66 countries and the treatment is individualized. In India, I don't have to say much. Our Prime Minister also recommends holistic treatment. एंड अभी नितिन गडकरी उनका भी नागपुर में कुछ तो कॉन्फ्रेंस हुआ था, वहां पे भी उन्होंने काफी होम्योपैथिक मेडिसिन के बारे में बोला और वो खुद होम्योपैथी लेते हैं एंड ऑल दैट। द आइडिया इज टू मेक यू ऑल अंडरस्टैंड कि ये काम कैसे करता है, उसके सिद्धांत क्या है। उसका सिद्धांत है लॉ ऑफ सिमिलर्स, लॉ ऑफ होलिज्म एंड लॉ ऑफ इंडिविजुअलाइजेशन। और वो काम अपने इम्यूनिटी लेवल पे करता है, ना कि एक स्पेसिफिक ऑर्गन पे, ना कि एक स्पेसिफिक वायरस पे या बैक्टीरिया पे। सो नाउ इफ यू हैव एनी क्वेश्चंस प्लीज आई एम हैप्पी टू आंसर देम।
Doctor, this is Priya Ramchandani. I've been listening to your talk intensively. It's very nice. You know, it's a very informative talk. I'm very happy to hear that. But I have a problem. I'm a lady of 80 years old and keeping good health. But since last 2 years, because of COVID and other reasons, I got this very bad attack of acid reflux. Because the movement was less and socializing was less. So that continued for some time. So I was doing homeopathy. I was having homeopathy before that for my colds and coughs, which are chronic colds and coughs I have. But then I asked my doctor to give me medicine for acid reflux, but that didn't help. It didn't help much. So it's so much so that I lost a lot of weight. In about 6 months, I lost about 20-25 kilos. So I was very, very weak and still I'm weak. So I had to stop this homeopathy for some time. I had to resort to allopathy. Now, I have taken allopathy in the last 9 months. And that is, of course, I'm not saying that has weakened me, but it's made me all right. But I'm still weak. So do you think I should continue with allopathy or go back to homeopathy now? That's my question.
So initially you should go back to homeopathy and continue your allopathy side by side. Okay. Once homeopathic medicine starts showing more positive effects, then either your allopathic doctor or homeopathic doctor should gradually start reducing whatever allopathic medicine you are taking and then evaluate without the allopathic support. How do you feel?
I see. Okay, doctor. And I would also like to know your address. And are you operating in Bombay proper? Central Bombay? Andheri. Okay. So I'd like to have your details, your information details about where you are and where, if we can come and have an appointment with you.
The best, if you are going to a homeopathic doctor, you should stick to that doctor. Right. What my suggestion is.
All right.
All that you have to do is, you have to understand why the homeopath may not be able to help you is maybe he is not able to get the exact symptoms that a homeopath wants.
Okay.
So what you as patient can do is observe a little more carefully what are the symptoms of your acid reflux.
Yes.
कब होता है, क्या करने से होता है, क्या करने से कम होता है. If you try to observe these symptoms and then share it with your homeopath, then I'm sure that he will be able to crack the right medicine.
Yes, because of COVID, because she's a lady there, doctor's lady. So because of COVID, I couldn't see her personally. So I had to be on the phone with her. and on the phone you can't tell much unless she sees me personally, which she used to see me before the COVID started. But
Correct.
now I've not seen her because I've stopped taking it since the last 8-9 months. But as you rightly said, I should go back to her right now and then see what she can do for me. Right?
Yes.
Okay. Okay, doctor. Thank you so much. Thank you.
Sometimes we have to understand that I'm not saying that I'm here or homeopathy is here to cure 100% of the problem.
Yeah.
Neither I am against allopathic medicine, that allopathic medicine is useless and all that. I have high respect for allopathic medicine.
Yeah.
But my approach is that if something is can get better with minimum interference of modern medicine and your
Yeah.
own immune system can take care of, then
Yeah.
why not
Yeah.
give that
Yeah.
as first chance? That
Yeah,
is
definitely, especially at my age, I think I should do more with homeopathy than with allopathy. Allopathy cannot be going on and on.
unfortunately what happens now with allopathic, with all due respect, sometimes the side effects of the problem are so much
Yes.
that we forget the disease for which we are going and we start looking for solutions for the side effects of the problem.
Yes.
One of my patient had some skin itching problem and she was not able to have that much of patience. She went to an allopathic doctor. He gave some strong antibiotics, and that
Yeah.
antibiotics led her with severe burning in the urination. Now
Oh.
tell me, that burning urination is more bothering or the little itching which she had was better to have?
Oh. Right.
Unfortunately, patients sometimes in desperation take hurried decisions.
Yes. Right. No, you're right. I think I will go back to homeopathy. I'll consult her again and see what she can do for me. Thank you so much.
Absolutely.
Thank you.
Anyone else? Any other question you have or doubt about homeopathy? What you feel that homeopathy ki aisa hai ya whatever?
गुड इवनिंग डॉक्टर।
Yes.
किसी और को क्वेश्चंस पूछना है और शैल वी एंड द सेशन? किसी और को क्वेश्चंस है?
So my hand is not being raised. Hello, doctor. May I
Yes.
speak?
Yes, please.
Yes. मेरा सवाल ये था कि एक्चुअली आपसे मिलना ही था, मेन तो बात वही थी। ये जो आई एम ऑल्सो 72 years old, तो मेनोपॉज के टाइम से हार्मोनल इम्बैलेंस ड्यू टू विच दिस ग्रोथ एंड ऑल दैट,
Yes.
तो
yes.
उसके लिए मुझे मतलब आई नीडेड अ गुड होम्योपैथ। मैं लॉयल होम्योपैथी वाली हूँ।
अगर थोड़े
बच्चे
आपको
मेरे उसी से बड़े हुए हैं।
थोड़ा सा ये क्या है माजी, इट इज ऑल्सो नॉर्मल। जैसे हमारे बाल सफेद हो जाते हैं विथ एज, ऐसे उसकी कोई ट्रीटमेंट नहीं होती है। वैसे ये हार्मोनल चेंजेस आने के कारण कुछ चीजें ऐसी होती है दैट यू हैव टू लिव विथ इट। ओके। ये एक बीमारी नहीं है जिसको हमको ट्रीट करना है। होम्योपैथी विल ट्रीट एन इलनेस। जैसे आपने बोला शायद आपका हाथ ऊपर नहीं हो रहा है, नाउ दैट इज अ प्रॉब्लम, फॉर दैट देयर कैन बी अ सॉल्यूशन। But some illnesses like these changes that happen after a particular age,
certain age,
if they are taken care of at that particular age, maybe you can reduce the intensity of it. शायद हम intensity कम कर सकते हैं। बाकी बाल सफेद तो होने ही है, मेन में बाल जाने तो है, होने ही वाले हैं। So
नहीं, सफेद बाल नहीं से हेयर ग्रोथ।
exactly. So that happens because of the changes that come in the hormones. तो अगर हम उस टाइम पे शायद इफेक्टिव मेडिसिन लेते तो वो हेयर ग्रोथ इतना ऑब्वियस नहीं होता जितना आपको अभी बॉदर। मतलब आई डोंट वांट टू गिव यू फॉल्स होप्स कि अच्छा ठीक है
हाँ
आप होम्योपैथी लो और फिर बाल चले जाएंगे, ये
नहीं
पॉसिबिलिटी नहीं है। जिधर हो सकता है उधर कर सकते हैं।
ओके 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 थैंक यू डॉक्टर
थैंक यू।
Doctor, I am Lakshman Pai. I just want to ask, if you are taking some allopathic medicines now, and instead of suddenly switching over to some other form of medicine, say homeopathy, is there any contraindication if both are continued simultaneously?
No, both have to be in fact continued simultaneously, because you cannot reduce any allopathic medicine just because you've started homeopathic medicine. For example, you are taking medicine for blood pressure, so you start homeopathic medicine.
Yeah.
There are certain factors by which we identify whether the patient is getting better or not. Then once we know that yes, the patient is getting better, then we tell them to reduce or make the dose alternate days of the blood pressure medicine, and then measure the pressure on a frequent basis. In spite of that, the pressure comes normal, then gradually we reduce the dose further. Like for example, I told you about the thyroid patient, that she was taking some 50 micrograms of L-troxin or Thyronorm when she came to me. So after 3 months, I know that she was getting better. I asked her to stop it on Saturday, Sunday. She continues from Monday to Friday. Then after 6 months, her thyroid level is still normal, even after reducing the dose. Then we ask her to make it 25 mg or 37 mg, depending on what the situation is. And likewise, gradually you keep reducing the dosage.
But doctor, you gave the example of, let us say, blood pressure. Now, because you are taking allopathic medicine, your blood pressure is under control. Now, slowly you are switching over to homeopathy. At what stage you will know it is better or not? Because now you are under control.
Correct. So there are multiple factors by which we decide. So if there are any physical problems which the patient has, suppose along with blood pressure, you had headaches for which you came to me, then your headaches are better, which gives me an indication that the medicine is working. Or suppose we ask them about other factors, whether their appetite is normal, their motions have become normal, the quality of the sleep has improved, the ability to deal with stresses of life has also improved. They find a general sense of well-being. They feel more happy, more enthusiastic, more active, more positive. When all these changes we see happening in a patient, that gives us an idea that the patient is getting better. And then we decide to reduce, not just, blindly.
हॅलो डॉक्टर,
Yes,
मी ज्योती ढवळे.
बोला.
मला कारण 3 आठवड्यापूर्वी ब्रेन स्ट्रोक आलाय. माझं वय 77 आहे
बर
आणि मला आता न्यूरोलॉजिस्टची ट्रीटमेंट चालू आहे. मला स्ट्रोक आला तेव्हा बोलायला येत नव्हतं अजिबात आणि हातापायाला मुंग्या आले आणि बधिरता आहे. तर आता मला बोलायला यायला लागलंय, हळूहळू बोलते मी, पण हातापायाच्या मुंग्या थोड्या कमी आहेत. ते डॉक्टर म्हणाले की कमीत कमी 6 आठवडे आणि जास्तीत जास्त 18 आठवडे लागतील.
बरोबर आहे.
तुम्हाला बरं व्हायला. तर ह्याच्यात त्याला होमिओपॅथी घेतला तर काही आणखी बरं होऊ शकेल का?
हो, डेफिनेटली.
होय ना. हा बरं.
डेफिनेटली.
मी गिरगावात राहते त्यामुळे तुमच्याकडे येणं शक्य नाही मला.
काही नाही, तिकडे कोणीही तुम्हाला होमिओपॅथिक डॉक्टर असेल जे तुमच्या ओळखीचे असतील, तिकडे तुम्ही त्यांचा सल्ला हे घ्या आणि करा 3 महिने 6 महिने आणि सी हाऊ.
हॅलो, नमस्कार डॉक्टर, मी श्वेता कोष्टी. मला लायकन प्लॅनेटचं हे डिसीज आहे आणि मी 3 महिन्यापासून मेडिसिन घेते होमिओपॅथीचे, पण माझे इचिंग काही कमी होत नाहीये.
अशा केसमध्ये तुमच्या होमिओपॅथिक डॉक्टरनी परत तुमच्या बरोबर बसायला पाहिजे. नॉर्मली आम्ही इकडे क्लिनिकमध्ये काय करतो की पेशंटला औषध दिलं आणि 3 महिन्यामध्ये पाहिजे तसा फरक नाही पडला तर आम्ही पेशंटचा रिव्ह्यू घेतो. म्हणजे परत पेशंट बरोबर 1 तास बसायचं, परत समजून घ्यायचे आणि मग नवीन औषध.
आणि अगोदर फक्त पायांवरच होते आणि आता पूर्ण बॉडीवर ते
हो,
पसरले.
म्हणजे आजार तुमचा वाढत चाललाय.
हो, कमी नाही होत उलट वाटलं.
So you have to talk to your homeopath and tell him की I am not better. So see what has to be done. आमच्या क्लिनिक मध्ये फक्त एक फायद्यासारखं काय आहे की इकडे 10-20 लोक होमिओपॅथिक डॉक्टर्स आहेत. तर समजा 6 महिन्यानंतर पण समजा पेशंटला फरक नाही पडला तर आम्ही काय करतो की त्या पेशंटला पॅनल केस मध्ये घेतो किंवा त्यांची केस सिनियर होमिओपॅथ्स कडे घेऊन जातो, जेणेकरून 2 किंवा 3 सिनियर होमिओपॅथ्स त्या पेशंटची केस घेतील आणि मग त्याच्यावरती औषध सजेस्ट करतील.
ओके ओके,
एवढा
थँक्यू.
एक फायदा इन्स्टिट्यूटचा आम्हाला आहे, जे लोकल होमिओपॅथी मध्ये नसू शकतो.
पण मी अजून किती दिवस वाट बघावी लागेल की माझं
तुम्ही
इचिंग
त्यांना
कमी होईल?
अजून 3 महिने तुम्ही वाट बघा. या आजारावरती ॲलोपॅथी मध्ये अनफॉर्च्युनेटली काहीही सोल्युशन नाही. जर तुम्हाला 3-4 महिन्यामध्ये काही नाही फरक पडला तर तुम्हाला दुसऱ्या होमिओपॅथिक डॉक्टरकडे जायला लागेल.
ठीक आहे, चालेल. मी अजूनही 3 महिने त्यांचं औषध घेते आणि नाहीच झालं तर मी आपल्याला कन्सर्न करते.
शुअर शुअर शुअर.
ओके, थँक्यू
तर
डॉक्टर.
तुम्ही लक्षात ठेवायचं की होमिओपॅथिक ट्रीटमेंट मध्ये काय आहे की पूर्ण रिस्पॉन्सिबिलिटी डॉक्टरची अनफॉर्च्युनेटली नसते.
अच्छा.
इकडे रिस्पॉन्सिबिलिटी पेशंटची अशा प्रकारे असते की आपल्याला जो त्रास होतोय त्याचं कितपत ॲक्युरेट डिस्क्रिप्शन आपल्या होमिओपॅथिक डॉक्टरना देऊ शकतो आणि आपल्याला लाईफ मध्ये काय काय गोष्टी बॉदर करतात, काय काय गोष्टींचा त्रास होतो. बऱ्याच आपण काही काही गोष्टी आपल्याला असं वाटतं की हे काय डॉक्टरांना सांगायचं किंवा सांगायला लाज वाटते किंवा की अरे हे नाही सांगायला पाहिजे, हे मी कसं सांगू. हे अशा गोष्टी जर आपण डॉक्टरांपासून लपवल्या तर त्यांना राईट मेडिसिन शोधायला अवघड जातं.
अच्छा, ठीक आहे डॉक्टर, मी परत त्यांच्याशी एकदा बोलीन यावर सविस्तर.
येस,
बघूया मग. ओके, थँक्यू डॉक्टर.
थँक्यू. एनीवन एल्स?
डॉक्टर, मी बोलू शकते?
येस येस.
मी अलका टोंपे बोलते. मी 70 वर्षाची आहे आणि मला गेली 20 वर्ष डायबिटीस आहे. हाय डायबिटीस असतो, म्हणजे 350-450 पर्यंत पण असतो. आता मध्ये मी 2-3 महिने आयुर्वेदिक घेतलं, त्याने कमी झाला, पण त्याने मला पायावरती सूज वगैरे यायला लागली आहे, म्हणून मी डिस्कंटिन्यू केलं. आणि युरिन इन्फेक्शन वगैरे, आयचिंग, नंतर बर्निंग वगैरेचा प्रॉब्लेम होता, तर म्हणून मी ते डिस्कनेक्ट केलं. पण मला ॲलोपॅथिकचं तर बिलकुल काही हे नाही. तर होमिओपॅथिक मध्ये मला काही ह्याच्यावरती औषधं, म्हणजे सुजन पण येते पायावरती आणि डायबिटीस कमी व्हायला ऑफकोर्स आयुर्वेदिकने कमी झाला, पण तो आता परत वाढू नये आणि त्यातनं पूर्णतः सुटका होऊन मला बरं वाटेल असं होमिओपॅथिक रेमेडी. मी तुमचं जम्बोला घेते सकाळी एक वेळेला 10.
सिझिशियम घेता तुम्ही?
काय म्हणता?
सिझिशियम जांबोलिकम ना?
ते घेते, ते 10 ड्रॉप्स गरम कोमट पाण्यात. पण तरी सुद्धा म्हणजे माझं शुगर काही कमी होत नव्हतं, जे आयुर्वेदिकने झालं. पण आयुर्वेदिकने मला आता पायावर सूज वगैरे येते, खतळ, चप्पल वगैरे घालता येत नाही आणि चालताना पण बॅलन्स वगैरे तेवढा सांभाळता येत नाही.
प्रेशर कसं आहे, व्यवस्थित आहे का?
मला ब्लड प्रेशर नाहीये.
चेक केलंय ना?
हो, चेक करते मी. उलट कधी कधी लो ब्लड प्रेशरच दाखवतं बऱ्याच वेळेला, पण हाय ब्लड प्रेशर तर नाही. असं म्हणजे मध्ये वगैरे कधीतरी असं होत असेल तर माहिती नाही, त्यावेळेला काही चेक केला जात नाही. पण जेव्हा जेव्हा चेक करते तेव्हा ते लोक म्हणतात की तुला ब्लड प्रेशर नाहीये म्हणून.
ओके ओके.
आणि मला हर्नियाचा पण प्रॉब्लेम आहे, एक ऑपरेशन झालंय. तर होमिओपॅथिक मध्ये काही ह्याच्यावरती औषधं आहेत काय?
हर्नियासाठी ते ऑपरेशनच करायला लागतं, कारण की ते मेकॅनिकल प्रॉब्लेम आहे.
एक ऑपरेशन झालेलं आहे, आता सेकंड प्रॉब्लेम चालू झालेला आहे.
हा, त्याच्यासाठी म्हणजे आमच्या पुस्तकांमध्ये लिहिलंय की हर्नियासाठी औषध आहे, पण आता माझ्या 15 वर्षांच्या एक्सपिरियन्स मध्ये मी असं कन्सिस्टंटली नाही पाहिलंय की हर्नियासाठी औषध दिलंय आणि पेशंट बरे झाले. सेकंड क्वेश्चन जे तुमचा शुगरचा आहे, इफ यू ओनली रिलाय ऑन होमिओपॅथिक मेडिसिन तर युअर शुगर्स मे नॉट कम डाऊन, बट with homeopathic medicine, with current allopathic medicine and diet आणि exercise जर तुम्ही 4ही गोष्टी फॉलो केले, then there is good scope की तुमचे शुगर्स कमी येतील.
अच्छा,
कारण की डायबिटीज कसं आहे की औषधांपेक्षा आपण काय खातो आणि आपण किती एक्सरसाइज करतो ह्याच्यावरती खूप महत्व आहे. अनलेस की आपल्याला कधी स्ट्रेस.
डाएट म्हणजे मी सध्या काय तुमचं मिलेट्स चे भाकरी खाते आणि सब्जी राईस वगैरे कमी खाते म्हणजे. पण आता गेली 2-2.5 वर्ष माझं हे कंटिन्यू चालू आहे, तरी पण माझी शुगर काही कंट्रोल मध्ये तशी येत नाही.
म्हणजे शुगर येणार, म्हणजे शुगर वाढणार, कारण की त्याच्यामध्ये कार्बोहायड्रेट्स असतात ना.
नाही पण मी राईस खातच नाही, बरं कमी खाते म्हणजे असं. पण एरवी खाते ते भाकरी खाते. गेली 2-2.5 वर्ष म्हणजे मी मिलेट्सच्या मिक्स याच्यावरती भाकरी भाकरी आणि भाजी एवढंच खाते.
अच्छा,
हा,
ठीक आहे ना. वी कॅन सी हाऊ टू हेल्प यू, बट यू हॅव टू ऑल्सो अंडरगो डायट आणि एक्सरसाइज ऑल्सो.
एक्सरसाइज नाही होते तेवढं.
कारण की आपण काही पण खाल्लं ना त्याचं रक्तामध्ये शुगर मध्ये कन्वर्ट होतं. तर आपण एक्सरसाइज केल्याने काय होतं की जी रक्तातली साखर असते ती यूज केली जाते. मग जर रक्तातली साखर यूज केली झाली की ऑटोमॅटिकली आपलं डायबिटीस कमी येतं.
अच्छा. पण मग
डायट दोन्ही म्हणजे खाण्यामध्ये असे पदार्थ वापरायचे जेणेकरून आपली शुगर वाढणार नाही किंवा कमी वाढेल आणि त्याबरोबर एक्सरसाइज पण व्हायला पाहिजे.
ओके. एक्सरसाइज होत नाही तेवढं खरं.
हो, म्हणजे सिंपल वॉक व्हायला पाहिजे. 10,000 स्टेप्स व्हायलाच पाहिजे दिवसातून.
ते होत नाही माझ्याकडनं.
हे जर तुम्ही स्टार्ट केलं ते स्टार्ट करून बघा 1 महिना, मग ऑटोमॅटिकली शुगर कमी यायला पाहिजे. आणि ऑफकोर्स स्ट्रेस वगैरे खूप असेल तर मग ते स्ट्रेसला ऍड्रेस करायला लागतं.
अच्छा, ओके, थँक्यू.
ओके.
Hello, doctor.
Yes.
Sir, my question is, actually it is not question, I'm asking you, like some people start studying homeopathic medicine in the later years of their life.
Correct.
So if one is interested in studying homeopathy, what is the qualification for that?
Good question. Actually, when we began with our institute, we had planned or started some lectures for laymen where we used to teach basic medicines in homeopathy. For example, if you get a hurt, what to take; if you have a toothache, what to do; or if someone gets a scratch, or someone falls down, someone gets a burn. So some basic things, what can be done. Such things were taken by the institute, but gradually the interest among public died down. So then we stopped encouraging such things. So it is nothing that you need a qualification. Of course, being a medical and non-medical makes a difference. But if we have some basic understanding about some basic medicines of homeopathy, then you don't need any major qualification.
Like I'm not a science student, but I'm interested in this.
Absolutely. There is no problem. There is no question of qualification. Basic things can be taught, irrespective of science, arts, or commerce background.
Okay, you said you told about psoriasis. So I am the patient of psoriasis for many years, though it is not so very aggravated, but it is a chronic one. So it can be cured 100%.
Absolutely, psoriasis can be cured.
Okay.
There is no doubt about it.
So the doctor has to take my history and all for that, no?
Yes, the process remains the same.
Okay, but you are operating from Mumbai, no?
Andheri.
Yeah, I am from Delhi. Okay, I will search for some homeopathic doctor around me.
Sure. Nowadays, so everything is online, so that distance doesn't matter for us as such.
Okay.
For us as doctors, it doesn't matter, but for patients, it matters because they like to show and come to the clinic and all that.
Yeah, like allopathic medicines have so many side effects. So I have started Ayurvedic and it is giving me some positive results, but still it has not cured fully. So I today after attending your program, I am thinking of switching over to homeopathy now.
No, no.
So,
If with Ayurvedic medicines you are better, you should
yeah.
continue that till a point comes where your condition becomes stable or status quo for 3 months. Then you should consider to change the path. If you're walking on one path and that path is helping you, then don't change the path. Because psoriasis is curable, but it is not an easy disease to cure. So
Yeah.
if you found results, then you should continue with what is helping you.
Okay, thank you so much. And what about the diabetic? I'm not diabetic, but I'm asking for diabetic patients. Like homeopathic medicine is sweet in, okay, sweet in nature. So what about the diabetic patients? Can they take this medicine?
The nature, the quality of this sweetness is different from the sugar that we consume. Sugar has a huge amount of sweetness, which has a tendency to increase your what do you say, sugar levels. But we have to understand these medicines, know how they are prepared. You know that sugarcane juice, right?
Yeah.
The leftover of that sugarcane, where all the juice has been extracted, and the leftover is called as molasses.
Yes, yes.
Now what we do is we take all that molasses together, we crush it and make it into a powder. And then from that powder, the pills are made. So the sugar content has already been taken out. So it has no scope of increasing the sugar levels. And the pills are hardly 4 pills once a day or twice a day. So that doesn't matter. It is as good as having one bite of a roti, which can increase that kind of sugar level.
Okay. Thank you. Thank you, doctor.
Okay.
Hello, doctor.
Hello.
On behalf of Graceful Living, I would like to take the opportunity to thank you for your such a valuable time. And in brief, you have explained. आपने बहुत ही simple language में explain किया आपका presentation में with example, with history, research, everything what is related to homeopathy. You delivered such a way that which will be useful to all the participants, I hope. And to all the participants for your active participations. So on 29th April, we are having a webinar that is on Zoom at 5:30. So आप सभी join कीजिए, वो webinar भी आपके लिए बहुत useful होगा. And Graceful Living सभी social media पे है, Facebook, Instagram. You can kindly go and visit our website for more details. Once again, thank you so much, doctor, and all the participants.
Thank you so much for this opportunity. We as our institute have a deep desire in our hearts that the basic principles of homeopathy should reach to common people, so that there are no misconceptions. Many people have some very bad misconceptions about such a lovely and a gentle science. And I'm very happy that you gave me an opportunity to share what homeopathy is, because this is something very close to my heart, that it should reach to as many people as possible. And
Thank you. It was a pleasure to have you. And sir ने अपने details share किए. If anyone want to contact, you can contact them for the consultation and regarding everything you need. Thank you. Have a good evening.
Thank you.
Thank you, doctor.